Greetings, this is Dr. Jess, and welcome to part two of my series, Ask Me Anything About Anything. In this segment, we're going to talk about what causes illness and the importance of the cell. Please note that if you really want to understand why you're ill, you have to start at the cellular level and understand what damages the cell, because the cell is the basic unit of life. And when we damage our cells, we damage the entire body. If you look at things from this point of view, then healing from almost anything becomes possible. So think about this. Cells get together, they create tissues. Tissues get together, they create organs. And organs that work together for life is a body. So instead of treating from the outside in, which is done mostly, especially in traditional medical circles and so forth, which has its value, no question. Okay, the way I work and the way usually things go if somebody's not getting better, we need to look at healing at the cellular level. So if you heal your cells, you heal yourself. This brings us to the question of, is there a common ground to all illness? No matter what we're talking about, is there a common ground? Yes, there is. Dr. Robert Navio, in 2013, he's an MD, PhD at the Metabolic and Mitochondrial Disease Center at the University of Southern California in San Diego, wrote an article called The Metabolic Features of the Cell Danger Response. Yes, it's real complex, but let's break it down. What injures a cell? What creates cellular injury that will lead to pathology? Well, some things that make a lot of sense. Chemical and physical, heavy metals, BPA, benzene, heat, salt, shock, radiation, trauma, and many other poisons will attack the cell and injure it at the chemical physical level. Microbial, mold, fungi, bacteria, parasites, viruses. That all makes sense, doesn't it? Okay. But do you know that yelling, abuse, isolation, abandonment, PTSD will damage the cell just as much as viruses and bacteria, just as much as heavy metals like mercury and so forth? It may take longer unless it's an acute occurrence, okay, but it will damage the cell just as much. And this is on a physiologic basis, not a mental illness basis. And in our time frame, in this time in history, we have to be cognizant of the spike protein from COVID or from the COVID vaccinations. These, the spike protein causes all kinds of pathology, and if anybody has had COVID or the jabs or the vaccinations and has a chronic illness and it got worse, and you never really came back to at least your baseline, this is the reason, and you have to be detoxified from it. People who weren't ill, who either got COVID or got the jabs and so forth, and never fully recovered, this is the reason. So what is a cell danger? So what does cell danger response do to you? Well, when it's chronic or persistent, your whole body metabolism is affected, your gut microbiome is affected, all your organ systems suffer, you can get behavioral changes, and so on and so on and so on. What cell danger response does when it's consistent or persistent is block the healing processes of the cell. When it's acute and self-limiting, we have mechanisms that will reverse it and you'll get better. But very often, there are multiple causes for for cell danger response, which makes it chronic, and the body's cellular systems don't actually reboot, don't get back to normal. And Dr. Navio in his paper showed that these diseases, autoimmune diseases, degenerative disorders, autism spectrum disorders, neuropsychiatric disorders that you're seeing on your screen right now, are all a result of chronic cell danger response. Why so many different manifestations? Well, then your genetic predispositions come into effect. So when you get ill, and I'll tell you exactly how that expresses in the next slide, whatever your weak pathways are will express. Your genetics are not your destiny, but this is what causes those genetic predispositions to express. And it all comes out as chronic inflammation, which is the root of most diseases. And you'll see terms like oxidative stress, reactive oxygen species, reactive nitrogen species, and so forth. These are all the oxidating compounds that will cause illness, and the beginning of that, the initiation of that, is in the cell danger response. And I'm sure you may be familiar with the fact that chronic inflammation can affect many, many different systems and cause things like cancer, arthritis, Alzheimer's disease, neurological diseases, cardiovascular diseases, autoimmune diseases, pulmonary diseases, type 2 diabetes, and so forth. I realize that the medical literature says things like autoimmune disease are not reversible and are essentially a roll of the cosmic dice. But if that were true, if it were just genetic, then it would have been present at birth or in very early childhood. The fact that these diseases appear later on in life, they are initiated from the chronic inflammation. And if you know anybody with autoimmune diseases, often they have several of them, at least two or three or four, and that's again because of chronic inflammation, and that allows the polymorphic genetic pathways, those pathways that are weaker by their nature, to express. Something interestingly, chronic inflammation will cause the neurological system, the endocrine system or your hormones, and the immune system to become dysfunctional because those systems talk to one another in constant conversation. And it's called the neuroendoimmune supersystem because these three systems have the receptors for each other's biomarkers. Things like the central nervous system puts out neurotransmitters, and these systems all have the receptors for that. The immune system puts out cytokines and chemokines, and the other systems have the receptors for that. And the endocrine system puts out hormones, and those other systems have the receptors for that. So the fact is that, just like NATO, an attack on one is an attack on all. I recently did a lecture for the Ultimate Hormones Conference in the UK, and my lecture was what happens when you're treating and doing your proper treatment for hormones, but it's not working. It's the other systems you have to look at because that's what's causing the dysfunction. So what else does chronic cell danger response or chronic inflammation call? And I spelled chronic wrong, sorry. I can spell, I just can't type, sorry. It causes the expression of genetic polymorphisms, or genetic SNPs. And in a future installment of this series, I'm going to explain genetics. A lot of people have mistaken the value and the information that genetics can tell you, and they get jumping down the rabbit hole. And I like to set that straight so people don't worry, and I should tell you exactly what to do about these things. The fact is you're born with your genes. You're born with your genes. It's the chronic inflammation that sets things off. So if you treat that at the cellular level by attending to not only what causes a cell danger response, but its effects, then you'll create healing. So why do we have so much chronic illness in our society? Well, because people need to treat the cause, not just the symptoms. More than that, chronic illness should be treated differently than an acute illness. In general medical practice today, the thought is, well, if I take care of the root cause, the body will take care of itself. And like the late, great John Pinette, the comedian, would say, oh, nay, nay. Dr. Nevi again did another paper in 2018 called The Metabolic Features and Regulation of the Healing Cycle, a new model for chronic disease pathogenesis and treatment. You can't treat a chronic illness like an acute illness. Although treating an acute illness, identifying the root cause and treating the root cause is really important. But when dealing with a chronic illness, the treatments based on the rules of acute care medicine have proven less effective and can even cause harm by producing unwanted side effects. And honestly, when I read this, which I already knew this, but when I read this, I was so surprised that an MD, PhD wrote this. It happens to be very true. You need to treat chronic illnesses from the inside out and from the outside in. That takes a lot of experience and a lot of practice and a lot of knowledge, but it needs to be done. You need somebody who's going to do the work. So, I promised to keep it under 10 minutes, and that's what I'm doing. I tell your friends, subscribe to my YouTube channel. Okay, if anybody would like to ask questions, you can email me at either office@drjessarmine.com or jess@drjessarmine.com. If you have a condition that you want to know if I can help you, go ahead and go to my website and book a free 30-minute get acquainted session. And why would you want to treat with me? Well, I'm a world-class practitioner with 5 decades of eclectic healthcare experience. Let's say we treat with specialists these days instead of generalists. The specialists will only consider what's in their area of expertise, which is what they should be doing, but it doesn't help you if you have a multifactorial illness. I'll consider everything about you and treat you in a holistic manner. And when I say holistic, I mean the best of traditional and non-traditional medicine. Specialists usually dictate to you about what has to be done. I'll make you a partner in your healing journey. And let's face it, we've all run into doctors who explain things with scientific babble, whereas I'm very well known for explaining things, your condition, in an understandable manner and answer all your questions. And sadly, some practitioners insist that you get numerous expensive tests before you see them, whereas I will review your findings and discuss the need for any additional tests if necessary. So really all you have to decide is how would you rather be treated? If you want to know, just go ahead and book that 30-minute get acquainted session. And never forget, if no one told you they love you today, remember, Dr. Jess does. I'll see you next week.